The Australian Medical Association has launched a plan to address the critical problems facing GPs. It involves 7 changes, including changing the GP training program and expanding the number of nurses and allied health services available in general practice. Joining us live is the Deputy AMA President, Dr. Danielle McMullen. Dr. McMullen, really appreciate your time. Thank you. You've identified a lot of problems here and come up with some solutions. What would you say, though, is the biggest challenge confronting our GPs right now? What is the key priority?
The biggest challenge is that Medicare was started in the 80s when most people were seeing their GP for a cough or a cold or small acute illnesses. And since then, we've seen a huge increase in mental health and chronic disease, which, as many people know, takes longer with your GP to unpack and to appropriately provide that comprehensive care. So we really need these supports to general practice to improve the resourcing and funding for longer consultations, more time with your usual GP, and more support in that general practice environment with their support staff to make sure that patients of today are getting that comprehensive care that they really need.
And when we talk about more support for GPs, is that mainly a financial injection that you're after here in terms of looking to the federal government to inject more cash in the upcoming budget?
We know that the current government has earmarked $1 billion or close to $1 billion into general practice over the next few years, and we see that as a down payment on the investment in general practice. There's been years of underfunding and Medicare freezes and cuts that have led to a real world deficit in terms of funding for general practice. So it does need more money. It probably also needs some structural reform to the way we use Medicare in general practice and the way we support general practice to employ staff like nurses, pharmacists, other allied health professionals in general practice to make sure that we can provide that wraparound care to patients when they need it most.
It sounds like a lot of it comes down to needing GPs to really find more hours in the day. We've heard a lot recently about the aged care crisis. In terms of that, surely demand for GP services in that setting will only be on the rise. We keep hearing that emergency departments are so under pressure, and there's pressure on GPs to then deliver more care after hours around that. How do you go about sort of solving those challenges?
We know that prevention is better than cure, and that preventative healthcare happens in general practice, along with getting to chronic disease early and keeping that comprehensive care in place to keep people well as long as possible. Aged care also features in our report on some of the solutions for general practice to make sure that those most vulnerable in their senior years have access to general practice and that appropriate funding for medical care in aged care facilities. But the program needs to be comprehensive. We need to be attracting medical students to a career in general practice. We need to reward our trainees and make sure that they are supported through their training, and then make sure that patients are able to access general practice and that the Medicare rebates back to the patient leave general practice accessible for most of the population.
So when you talk about attracting students, for example, at medical school to be GPs, has there been a shift on that front? Do medical school students actually want to be GPs anymore? Is there a real trend towards most of them wanting to specialise?
We have unfortunately seen over the past couple of years a decrease in the number of senior medical students that are likely to pick general practice as their specialty. We know that once you get here that it's a very rewarding career, and general practitioners by and large are happy with their day-to-day work and really enjoy the work of being a GP, but that we're seeing more administrative hurdles, more financial difficulty in keeping businesses running, and those issues are reflecting back on our medical students, and they're starting to be a bit wary of choosing a career in general practice. And it's really important that we turn that around and encourage our students and junior doctors to pick a career in general practice.
Yeah, it sounds like a lot of the problems that were there pre-pandemic have only been exacerbated by the pandemic as well over the last couple of years. In terms of the COVID settings we have at the moment, what's your view on the scrapping of the COVID isolation rules? Did you think that Australia is ready for that step just yet?
It's obviously a difficult decision that governments have had to make around isolation rules, and our strong medical advice is for people to still realise that COVID is very much out and about, and to be taking those individual steps to reduce the risk of transmission. So that's wearing a mask when you're indoors in public places, and particularly if surrounded by vulnerable people, places like public transport, where our most vulnerable people tend to be using those services. And staying home when you're sick, just because the isolation rules have been lifted, doesn't mean that it's a responsible decision to go to work when you're feeling unwell.
As you say, COVID's still out and about. What is the outlook in the AMA's view, looking at how coronavirus waves are playing out overseas? What is your expectation as to what we can expect here in the coming months?
It's very challenging to predict what COVID-19 will do, but it is likely that we'll see new variants. What we don't know yet is how severe or how transmissible those variants will be. And I think our government, as well as our population, need to take this bit of a breather that we've got at the moment, but be prepared for those public health settings to need to change if we're to see a more severe variant emerge in our population.
Dr. Danielle McMullen joining us live there. Appreciate your time. Thanks so much.
Thanks.